and welcome to CDI Linkit Clinical Documentation Specialist Services. I'm Annette, and today we're going to review a research paper that is relevant to clinical documentation improvement and the work that we do as clinical documentation specialists. So the article is, the article we're going to be looking at is by Fisher, Patterson and Ma, Enabling Clinician Engagement in Safety and Quality Improvement. This was an Australian study published in the Australian Health Review in 2021 with CSIRO Publishing. All three authors are affiliated with the Clinical Excellence Commission, which is the lead agency supporting safety and quality improvement in New South Wales Health. So if we look at what the purpose of the study is, the aim was to determine factors that influence clinician engagement in safety and quality improvement. And what the study had found was that the most critical factor for influencing clinician engagement is leader behaviour, and that leader behaviour influences team dynamics as well as individual clinicians' motivation and empowerment. So that's interesting and certainly relevant to what we do as clinical documentation specialists. So let's have a closer look at this study. So the introduction to the study has outlined what was already known prior to this research, and there's pretty much a consistency around in the literature regarding the challenges individual clinicians perceive about patient safety and quality improvement work, and that the role of the leader or manager is crucial to enabling engagement, that positive leadership improves engagement, whereas negative or absent leadership decreases it. And that perceptions of the purpose of engaging in safety and quality improvement work certainly drives engagement. And that clinicians may be wary of the intent, but they will engage if the safety and quality improvement work is deemed genuine in improving patient care. And that engagement decreases when safety and quality improvement work is perceived as a waste of resources, or, labour or non-labour, or creates more harm than good. So let's have a look at so that's what we already knew from previous research. And so now we're going to have a look at how this study was actually designed. So it's a quantitative study, which is basically the gathering and analysing numerical data to understand patterns and relationships or trends. And in this study, they used a questionnaire with a Likert scale to measure responses. So a clinical example of a Likert scale is what we use in clinical practice for assessing pain severity. So, on a scale of 1 to 10, how serious is the pain? And the result is a number, which in the research world would be statistically analysed. So in this study, the authors were looking to understand relationships between 5 factors influencing clinicians' perception of value for time and effort in safety and quality and improvement work. And those 5 things are psychological empowerment, task cohesion, social cohesion, transformational leadership, and value for time and effort for self and others. So the data analytic method used for the initial data analysis was correlation and regression analysis. Moderation and mediation analysis was then used to explore the relationships further. And finally, they used structural equation modelling to determine the path model. We'll talk a little bit about that when we talk about the data analysis and the results. So let's look at how the data was collected. A questionnaire was sent out by New South Wales Health Clinical Excellence Commission to, over 3,700 clinicians who had previously participated in a development program. And potential participants were given 2 weeks to complete the online questionnaire. Now, this went out via email, by the way, and it closed in May of 2019. They had 171 clinicians who responded to the questionnaire, and all of the clinicians had recent experience of leading or participating in clinical quality improvement programs or initiatives. So as you can see there on the slide, the breakdown of the professional groups, we've got medical, nursing, pharmacy, allied health, and health management. So, I mean, just looking at those numbers, 42 out of 171 for nursing. So certainly nursing, it's not a true reflection of the healthcare workforce, those response rates, because as we know, nurses and midwives take up or account for like 60% of the total workforce, healthcare workforce. Is this important to know? I guess it may or may not skew the results of the study, but had a bit fairer representation. But, it's really difficult to get a true reflection of healthcare professional groups unless, as part of the recruitment strategy, specific groups are targeted and that there's some sort of quota for each professional group, but that hasn't happened here. Is this important? Well, my thoughts are that nurses certainly, as a professional group, do a significant amount of quality improvement projects, mostly ward-based and mostly not communicated outside of the ward or the organisation. But, it does occur. And so missing the opportunity to engage with such a large professional group for a study like this, it's perhaps an opportunity missed, I guess. It doesn't mention in the paper, but if we were to take a deep dive into the data and compare the results between the professional groups, this might provide a rationale as to why the underrepresentation of nurses wasn't identified or listed in the paper as a limitation, although it kind of maybe has been brought up in that they do mention the sample may not be a true reflection of the population, but it doesn't specifically call out nursing. I mean, at the end of the day, there may be no statistical difference between the professional groups, and therefore, even if there were more nurses in the sample, it would be unlikely to have made any change, to be any change to the results. But, it's something to keep in mind, though, something when you're looking at research studies, that this is the sort of stuff you kind of need to be on the lookout for and to think about, well, will it affect or has it affected the results? So how is the data analysed? I'm going to be honest, and I'm not a quantitative researcher, nor am I a statistician. So for me, this can sometimes be a little challenging to work out when reading research papers, because we want to know that the researcher is interpreting the results. The way that they're interpreting it is a true reflection of the data. But I will attempt to make some sort of sense out of what this is all about. So as mentioned, the researchers used regression analysis initially. And what this is, it's a statistical method that is used to examine relationships between 2 or more variables and interests. So the variables of interest are, we go back to that psychological empowerment, task cohesion, social cohesion, transformational leadership, and value for time and effort for patient, for self, and others. There's several types of regression analysis: linear, non-linear, multilinear. But you may have heard of those, but I'm not going to go any further into this because it really is outside my scope of my abilities of understanding. But basically, they all examine the influence on one or more independent variables on a dependent variable. So in this study, The dependent variable is value for time and effort for self and patient and others. And all of the other ones are the independent variables, you know, the psychological empowerment, task cohesion, social cohesion, etc. So what this means is that the researchers are looking at each of the independent variables individually and looking at their relationship to the dependent variable, which, as I mentioned, is the value for time and effort for self and others. So if you look at the table there on the slide, you'll see that they've got the 4 measurements. They've got, actually, it's 5 measurements. I can't count. It's the mean, the confidence interval, the beta, the t-test, and the p-value. I'm also not going to go into each of these statistical tests, but I will say that irrespective of what statistical testing method is done, for quantitative papers or mixed method papers, there always seems to be the confidence interval and the p-value. So I guess it's important for us to understand. So we'll just go through that. So confidence interval tells us how confident it is that the range of values of the sample population includes the true average for the full population. And we are ideally expecting the confidence interval range to be quite narrow. The sample population are those that participated in the questionnaire, which was the 171 respondees, and the total population are all clinicians working in healthcare. A p-value of 0 means that the likelihood of the results occurring by random or chance is extremely low. So that's what you're looking for. You're wanting, you don't want it just to be luck or chance that you've managed to find this result. So usually looking for a p-value to be less than 0.5. However, in some research, that p-value is set much lower, such as 0.01. However, in this type of a study, you would be expecting for it to be at least less than 0.05. So if we just have a look at the transformational leadership, the mean is 0.214. That's the mean average. The 95% confidence interval is 0.104 to 0.324, which is narrow. That's a narrow range. And the p-value is 0. So what does this mean? My understanding is that it means that the mean average for the sample is 0.214, and there is a 95% confidence that the true mean of the whole population sits between that range of 0.104 and 0.324. And then you add in that the p-value is 0, tells us the likelihood this result is by chance is extremely low. And so given the narrow range, 95% confidence and the p-value of 0, this result would be considered statistically significant. And I'll let you go through the others there, but certainly look at psychological empowerment because it's got a very similar result to the transformational leadership. So basically, in a nutshell, this is suggesting that that these results are not random. There's a high probability they reflect the total population and that they are statistically significant. So then the third part of the analysis is that they then used the structural equation modelling, and they've come up with this diagram to visually represent their results. And what it shows is significant influence of the behaviours of transformational leaders have on individual intrinsic motivation and empowerment and positive team dynamics, which then influence willingness of clinicians to engage in quality improvement work. I'll just point out a little about the group social cohesion and group task cohesion. So both of these impact on the positive group dynamics. And social cohesion is just, you know, that feeling of belonging or sense of being part of the team. And task cohesion is the team alignment around the common aim for the task, and very clear roles within the team in order to complete the task. All right, so we've got the results. So before we do anything else, before we even start thinking about, well, what are the implications for practice, we need to decide whether or not we think we can trust this study. We're really wanting to know, is this study of high quality? So when reading a journal article, particularly a primary research study such as this one, we need to know if it's credible and that we can trust the results, that we can trust the interpretation of the results and also the conclusions made. There are many, many different frameworks that we can use to determine the quality, the rigor, or the trustworthiness of a study, but I particularly like this one, CRAAP. So it looks at currency, relevance, authority, accuracy, and purpose. For me, it's just an easy one to remember. So really, we're just wanting to know that the study is current. We're wanting to know when it was conducted. Is there sufficient data? Does it fill a gap in our understanding? Are the authors' affiliations sound? Is there a political agenda? Has there even been ethics approval provided? Is there sufficient data or evidence to support the arguments or their conclusions? Is there any obvious bias? Is there a clear aim and purpose, and are limitations noted? So let's have a look at this study using the CRAAP framework. So in terms of currency, it was published in 2021. The data was collected in 2019, and that's quite common. It can take up to couple of years from when the data is collected, and then the paper is submitted and published. And usually you do see a bit of a couple of year gap or a year difference there. So I also had a look at the references. Now, some of them are more than 20 years old, but you know, there are still many there that are within the last 10 years or so. So you're just looking to see that they're referring to the most current research that's been done in this space as much as possible. So relevance, the article certainly gives sufficient detail, for me anyway, around the rationale as to why the study was important, and also provides really good detail on the methodology. Authority, all three authors are affiliated with the Clinical Excellence Commission. The first author is a PhD candidate, and certainly CSIRO is a credible publishing entity. And there's good detail there around the ethics approval and providing details around that. Accuracy, yes, there's very good detail in the data analysis and how they came to their conclusions. You know, I may not have understood it completely, but certainly enough to say that the analysis seemed to align with the study findings. And then lastly, we come to purpose. They noted no bias, such as a funding bias. And, you know, an example of a funding bias would be if researchers were doing some research around, I don't know, the effectiveness of a particular drug, and their research has been funded by Big Pharma, then you could see that there could be an allegation of funding bias. Certainly not the case in this study. There were clear aims and purpose for the study, and limitations. The study limitations were noted. The one that was noted was around the potentially the similarity of the sample may or may not have affected the results. So, you know, from my CRAAP assessment, I'd say this study is trustworthy. And so now we can look at what the implications does this study provide for clinical documentation specialists. There were probably, I think, two things that were highlighted for me was that clinicians engage when there is perceived purpose and it's of value and there's a positive impact on patient care. And also that leaders influence clinicians' motivation to engage. And I think that's a really, really important for the work that we do, because realistically what we do around clinical documentation improvement, it is quality and safety. Quality improvement work, I think we really need to think about a lot of the work that we do is with clinicians on the floor and, you know, at ward level, and it's the individual clinicians that we're working with, particularly, you know, realistically from a medical point of view, most of the work we do is with interns, generally, as they do a vast majority of the documentation, but they are the ones that we're dealing with on a day-to-day basis. But perhaps we need to be thinking, how do we engage the leaders? How do we look at how they can help to influence clinicians' behaviour? Because that's really what we're looking for, is behaviour change of the clinicians that are documenting. So what also was highlighted for me is the need for clinical documentation specialists to, you know, focus education and conversations with clinicians around the purpose for improving clinical documentation, really driving home the quality and safety aspect for patients, particularly, you know, communicating for safety, you know, within a multidisciplinary team, but also the quality and safety aspect for themselves, for being a safe clinician, providing safe care. And perhaps to be a little careful around focusing too much on the financial remuneration to the exclusion of safety and quality aspects. So that's where we come to an end. I do just want to mention on this next slide, we do have a community of practice for seasoned clinical documentation specialists or clinicians who are interested in this area, or clinicians who are thinking about moving into the CDI space. Contact details are there. Make contact and we will set you up to join a really great group of clinical documentation specialists who are also clinicians.